Well, hi, everybody. My name is Dr. Jeff Schroeder, and I am pleased to be your instructor for this next course in the program, Evidence-Based Practice NU602. Each week I'll be posting one of these little videos. My videos aren't really so much meant to be instruction per se. I'll be covering a little bit about the topics, kind of giving little introductions to what's coming up for the week, and be giving up a wrap up of the discussions that we'll be having in class. So usually these videos will last somewhere between 5 and 10 minutes usually not too much longer than that. Um, and they're really just a way for me to have a little bit more personal interaction with you as an instructor, to let you know that there really is somebody that is actually teaching this class, and that you can have a little bit of face-to-face contact with. Um, and I think that it just helps to kind of keep the class a little bit more personal, and kind of having this weekly benchmark where every week I come in and give feedback really seems to help out. It's kind of one of those evidence-based practice things in education, is the more face-to-face time we have, it seems that the better the perception from students of how education is. So this is just one way I have of doing that. In week number one, we're going to be starting with a very general overview of evidence-based practice. This is a term that we've all used. I'm sure that you've all heard it through all levels of your education, but what it really doesn't mean. And really what it comes down to is that everything that we do in nursing everything that we do in nursing practice should be based in the literature somehow, in the research. What does the research tell us is the best way that we should do things? And it's something that we should be looking at in an ongoing way. It isn't something that we should just be waiting for a problem to arise where we have a sentinel event or somebody dies or something before we make changes. We should be looking at what is what is our practice? How can we be proactive to make sure that we're always doing that what is best for our patients and that which presents the best outcomes. And so in this first week, your first discussion question is going to be where you're going to discuss and tackle this issue of what is known as a PICO question. Most nursing research, starts with a statement or a question that really frames, this practice phenomenon that we're going to be looking at. And a PICO statement is a question that is written, and the acronym stands for a population. Or really, it starts with a problem. You identify a problem or a potential problem in nursing or in healthcare, and then you identify a problem, an intervention that you're going to apply, which is typically some form of new practice that you want to try out, and then the intervention that you're going to compare that with, called the comparison, and a measurable outcome, and a time frame that you're going to be using to assess to see if your intervention did show an improvement in outcome. And so this would be an example for a PICO question would be like, if I were to address the problem of hand washing, or the problem of increased hospital-acquired infections due to nurses not washing their hands. PICO question might be for medical surgical nurses. Does implementation of a new training program, including videos and ongoing monitoring by nursing managers, compared with current practice of only doing annual trainings on hand washing, result in a decrease in hospital-acquired infections when measured over a 6-month period? That would be a very basic, very straightforward type of a PICO question. So that's really your task for this week, is to come up with a problem and think of what would be a good PICO. There's some good articles and some good resources to help you with that. The discussion questions, just a couple things about me as an instructor in general. I tend to follow the rubrics pretty closely for not only the assignments, but also for the discussion questions. So you want to go ahead and review the really for all the assignments, review the rubrics. If you have any questions, always let me know. Feel free to post a question in the Ask Your Instructor. Uh, there's a discussion place where you can go ahead and post questions. Much easier if you just post it to questions of the class, so I can answer it for everybody, as opposed to having 15 people all send me the same question or variations of the same question. So don't feel afraid to post your questions in class. I'll be checking the class at least daily. Um, if it goes more than about 24 hours without an email response, please, send me another email, so I will go ahead and follow up with that. I try to have all emails answered within 24 hours. We have a 24 to 48 hour time frame that we are required to respond to emails, but generally I try to get them done within about 24 hours or so. I am on the West Coast, so realize there is a time difference. If you send me a message, for example, late in the evening, I may be able to get to it that night. But if you leave me something in the morning, I'm probably not going to see it until, later in that day. So there is a time difference. So just be aware of that. I'm seeing things and answering things, and I'm available generally kind of in a 3 hour shift from what most of you anyway are, assuming that most of you are on the East Coast. So, I look forward to being with you. Oh, and remember, it is two substantive responses to peers. They should be done on different days of the week, a minimum of that. Um, Posts that exceed the minimum are required for full credit. Posts that meet the minimum requirement will get at least that minimal credit score. Um, and the first response is due by Wednesday. Your initial response should always be cited and follow API guidelines. Follow-up responses no later than Saturday night. And I generally try to have all my grading done by midweek after after a week is shut down. So I look forward to being with everybody. I look forward to participating in the discussions with you. As you have any questions, please feel free to let me know. Most of my discussion this week will just be in the student lounge and getting to know you when you post your introductions. So I look forward to getting to know everybody. Let me know if you have any questions, and let's have a good week.